You know, so much of the most important work that keeps us healthy happens completely out of sight. It's not in a hospital, it's not in a clinic. Today, we're going to pull back the curtain on that invisible shield that protects all of us: public health. Okay, so let's just think about this for a second. When somebody says the word healthcare, what's the first image that pops into your head? For most of us, it's this, right? A single doctor, a single patient. It's personal, it's direct. But what if I told you that's really only half the story? And this slide just lays it out perfectly. On one side, you've got clinical medicine. That's all about treating one person who's already sick. The goal? A cure. But on the other side, you have public health. Its focus isn't just one person, it's the entire community, the whole population. And its main goal isn't to cure, but to stop people from getting sick in the first place. So let's step out of that familiar doctor's office and really get into what this massive preventative effort is all about. Okay, so here's the core idea. Public health looks at health not as a bunch of separate individual problems, but as a community-wide thing. And by doing that, it lets leaders and officials set priorities, like what's the biggest threat to our city right now, and then figure out the smartest way to use our resources to tackle it. And you might think this is some new idea, but get this. This classic definition from C.E. Winslow is from all the way back in 1920. I love that he calls it both a science and an art. It's about using hard data and organized teamwork to stop disease and help people live longer, healthier lives. It's not just about not being sick, it's about actually thriving. So, how on earth do you manage something this huge? It's not just chaos, I promise. The whole system is actually built around 3 core functions that give it a really clear framework. And here they are, laid out almost like a cycle: assessment, assurance, and policy development. Basically, you identify the problems, you make sure there are solutions, and you create a plan. But each of these steps has a super specific job. So let's break them down. First up, assessment. Think of this as the detective work. This is where public health professionals use all kinds of tools, like epidemiology, which is the study of how diseases spread, plus sociology and biostatistics, to get a really clear picture of a community's health. You know, what are the big issues, who's most at risk? This is where they get all the crucial facts. Okay, so you've found the problem. Now what? Well, that's where the second function, assurance, comes in. See, it's not enough to just know what's wrong. You have to make sure that the solutions are actually available to people. This means making sure that health services are easy to get to, that people can afford them, and that they're actually good quality. It's like a promise that care will be there when people need it. And the last piece of the puzzle is policy development. This is where the big picture strategy happens. Based on all that data from the assessment, leaders create the actual rules, the guidelines, and the funding plans to make people healthier. This could be anything from a citywide ban on smoking in restaurants to getting money for vaccination programs. This is how you make real, lasting change. All right, enough with the theory, right? What does this actually look like in the real world? Let's talk about some of the concrete ways public health is in action all around us every single day. A lot of this work is about protecting the basic stuff we totally take for granted. I'm talking about things like restaurant health inspections, making sure your food is safe, regulations that guarantee the water coming out of your tap is clean, or even ad campaigns encouraging people to exercise. This is public health just quietly doing its job in the background. But then, public health also becomes front and center during a crisis. This is the team that's constantly watching for disease outbreaks to stop them before they start. They're the ones who investigate epidemics when they happen and who make the plans for what to do in a disaster. It's also about making sure your workplace is safe. This is the protective, always-on-guard part of the system. And this part is so important. Public health is also about fairness and always getting better. It means actively reaching out to groups who might be at higher risk or who don't have as many resources to make sure nobody gets left behind. It's about getting communities involved in their own health and constantly funding research to find new and better ways to do things. So when you start to put all these different pieces together, you really begin to see the bigger picture. This isn't just a random collection of tasks, it's a whole system, and it's designed to protect every single one of us. And that's really what it all boils down to. Public health is a systematic social action. It's not random at all. It's a planned, organized effort by the entire community, for the entire community. It's all of us working together to keep each other safe and well. Which brings us right back to that main idea we started with. Public health really is that invisible shield. Most of the time, you don't see it. You might not even realize it's there. But it is always working, deflecting threats and keeping our communities strong and healthy. So I'll leave you with this question. Now that you know what to look for, now that the shield isn't so invisible anymore, where are you going to notice public health at work in your world today? I think you'll find the answer is pretty much everywhere.